All right, so she spent nearly 30 years treating pain until a life-changing diagnosis left her nearly bedridden. Now Dr. Amy Adams is using that experience to help others find relief without surgery or pain medications. She joins us along with her patient, Jenny Watford, to share how regenerative medicine is changing lives. Good morning.
Good morning.
All right, board-certified interventional pain physician. As we know, pain's hard for anyone to deal with, but it's also how we've been treating it over the years has gotten a lot of people in trouble.
It has. The medications obviously are often addictive and always have side effects. And then the procedures, you know, surgery leaves a lot of downtime. People just don't want to deal with
and
that
sometimes
anymore.
you cause the scar tissue and then other issues after some surgical procedures, and you start chasing things, if you will.
Absolutely.
All right, you spent decades treating chronic pain with conventional methods. What was your turning point when you said, okay, this is not working to really relieve or fix a problem? It may relieve a symptom, but it's not really fixing a problem.
Well, it was always short term. People had to come back over and over and over again, and it was just it wasn't working for anyone. So regenerative medicine came along. I started seeing the science and finally got the courage to treat someone who had never gotten better with conventional medicine, and lo and behold, it worked, and it worked long term.
Wow, regenerative medicine using platelet-rich plasma, PRP. Now explain what that is to people, because it's really helping the body to help itself.
It's absolutely amazing. So when you get an injury, your platelets rush to the area and form a blood clot, but that stimulates them to release all kinds of growth factors and other proteins that start the healing process. So we're really just leveraging that. We're concentrating your platelets and putting them where they need to be to speed up healing.
Yeah, there's nothing like being your own patient, doctor.
Absolutely.
Right? And you actually used this type of therapy for yourself.
Yes, I did. Back in 2019, my back went out and I could barely get from the bed to the bathroom safely. It was really quite frightening, couldn't work. Went and had this done on my back one time, and now in 2026, I'm still 90% better. And sometimes, you know, I can work in the yard all day. I need a couple of Tylenol. That's pretty normal, but that's about it.
Yeah. All right. You moved to Houston to practice regenerative medicine exclusively, because now not only are you hearing from your patients, you know it yourself. Yeah. And it can be used to treat several things that are problematic that oftentimes medicine doesn't really address very well. You mentioned back. Back is one of those ones where it can be iffy for a lot of people, right? Sometimes they just have to suffer through it because there might not be a right surgery for it, but also the medications aren't taking care of it.
Absolutely. There's a big gap between just conservative conventional care and surgery, where maybe you're not ready for surgery, but there's nothing else. Yeah. So regenerative medicine fills that gap very well.
Yeah, in areas like arthritis, which you know can be very problematic for a lot of people.
Absolutely, it is, and we all get it eventually, right?
Yeah, no.
So,
just speak for yourself. Back and spine, what you talked about, shoulder, hip, knee, so in all of the joints.
Absolutely, yes. The knee is probably the most common, but we see it in virtually every joint.
Yeah, and then of course the foot, which all those little small bones and stuff, sometimes it's hard to find exactly where the problem is happening, but with stem cell, and speaking of finding exactly where the problem is happening, one thing that you do, you're not just like shooting in the dark. You take time, first of all, to figure out what is the source of your pain. Sometimes we don't bother to do that. We just throw a medicine at it and say, here, we'll get rid of your pain. We got to know the source of it. And as soon as we can isolate that, then you get into, all right, let's target the area that needs to be dealt with.
Absolutely. If you don't have the right diagnosis, you're not going to have the right treatment.
All right, so the key benefits for patients, again, are you're not causing extra scar tissue, you're not causing extra pain, not causing all that stuff, and you're using the body to help itself. All right, Jenny, you live just outside of Austin, retired lawyer, and one of the things that you love to do with your retirement time is go out there and garden. And then one day, that wasn't so easy.
My knee began to bother me, and it just didn't stop bothering me. And it was painful every time I moved my leg.
Yeah.
So I couldn't garden, I couldn't go upstairs, I couldn't get up from a chair without hollering.
And that gets scary, because that's the beginning of a sedentary life for so many people, right? And it's just downhill from there. And then when you have a knee that bothers you, more prone to falls and things like that. What did you think it was at first?
Well, you know, I find with age, a lot of times you just wake up in the morning and something hurts. So I just figured, well, something just hurts. But it just didn't resolve. I spent a year in pain, and I thought so I was ready for a knee replacement. I was ready to sign up. And then I thought, no, I'll try the stem cells, and it's been amazing.
Yeah. So take us through the process. People always think about they may be in pain, but they're afraid of something being painful, right? So going through this.
Yes, no, it wasn't. It was, for me, I had 3 injections spaced a couple of weeks apart, and began within a month or so, began to see improvement. And then it's just continued to get better since then.
Yeah. And Dr. Adams, what is in those injections?
Well, various things. It's all tailored specifically to what your problem is. For Jenny, it involved something called A2M, or alpha-2 macroglobulin, to stop the degenerative process. We also used platelet-rich plasma, and then we used bone marrow concentrate from her own body.
Yeah. So that's
to
when we say
actually provide the stem
autologous.
cells.
Autologous means your own body.
It
right?
does, yes. You're using your own body as your pharmacy.
Yeah. What did you think? I know your deal was, look, I may as well do this before I get to the whole replacement thing. Were you really hopeful, or are you thinking,
I was hopeful, but I was a little skeptical just because I'm 68, and so I didn't know if my 67-year-old stem cells were going to have enough to help. I just didn't know if that would work.
That is a good point. So almost at any age can do this, right?
Absolutely. We've treated people well into their 90s.
Wow. Okay. So it was like a year ago, and you were just so happy with it.
Pain-free.
Yeah. What would you say to somebody who is struggling through, and we keep thinking, pop one more pill, and I'll do something about it tomorrow. I'll do something about it tomorrow.
I'd say call LifeStem.
Yeah.
It's the healing is out there if you get it.
Yeah. All right. Who is a candidate, Dr. Adams?
Well, not everyone is. We like to really go over your nutritional status, and we will usually draw some labs. And if you're really basically healthy, you're probably a good candidate.
Yeah, but let you all decide. You'll do all the diagnostics
Absolutely.
on that to make sure, so that you can get out of pain the way the body probably was intended to get out of pain. All right, if you don't mind, being a gardener, we're having problems with a plant over here. Ralph, could you bring it over to her, perhaps? Yeah, that one right there. It used to be really big and bushy, but now it's thinning out. It's thinning out.
It does look a little off.
Yeah. Is it because it's plastic?
I think that could be
It's
it.
because it's plastic.
Yeah.
All right, good. Okay. All right. Okay. So we finally figured that. Finally figured it out.
Yeah.
All right. Maybe it needs some stem cells. All right. To schedule your consultation today, you can visit regenerativemedicine.net. Regenerativemedicines.net. You can also give them a call at this number. It's 346-588-7836. Again, 346-588-7836. Take the first step toward moving better and getting your life back and becoming pain-free. And as we mentioned, there are so many areas of the body where people suffer with pain, and they can be resolved through stem cell. Thank you very much.
Thank you.